Today, we are fortunate to have a true nursing leader with us to deliver today's presentation on nursing education in challenging times. On September 1st, 2021, Dr. Eileen Collins became the 9th Dean of the University of Illinois Chicago College of Nursing. Prior to her appointment as Dean, Dr. Collins served as professor in the Department of Biobehavioral Nursing Science and in 2018, Associate Dean for Research for the UIC College of Nursing. Before joining the UIC community in 2002, she worked for 30 years at the Edward Hines Jr. VA Hospital. Throughout those years, Dr. Collins held multiple roles, ascending to the post of Acting Associate Chief of Staff for Research and Development. In 2016, Dr. Collins was inducted into the International Nurse Researcher Hall of Fame, which recognized her outstanding career in the field, as she has been continually funded for over 20 years by organizations such as NIH, VA, and various foundations. Between her time as a nurse scientist at the Hines VA Hospital and at UIC, Dr. Collins secured $41 million in research grant funding. Dr. Collins has published over 100 papers in peer-reviewed publications and is very active as a fellow in professional organizations. She's also served on the boards of the American Thoracic Society and the American Association for Cardiovascular and Pulmonary Rehabilitation. Everyone, please join me in welcoming Dr. Eileen Collins.
So good afternoon, everyone, and welcome. Thank you to all of you for joining me. I wanted to take this opportunity to reflect on where we've been over the past couple of years, and most importantly, eventually look ahead to where we're going and where we need to go. This has been a very challenging 2 years for all of us.
Anyone who's had a blood
in particular for those of us in the nursing profession, as well as in nursing education. Sometimes as time goes by, we forget about everything that's happened at one time. I kind of think of, I equate this a little bit to having a baby. By the time the baby is 3 months old, you've forgotten all the pain of labor and you're ready to have another one. I don't think that's the case with COVID-19 or what we've done in the last 2 years, but I thought that I would just take a look back of what the last couple of years have been like for all of us. So 2020 and 2021 put a stress on our healthcare system, as well as on all of us, like nothing we've ever seen before. Frontline healthcare providers dealt with an unprecedented demands, risk to their own health and that of their families. A healthcare system that was not terribly nimble at the time. And not only was it not nimble, but there were highlighted major disparities between the haves and the have-nots when it came to healthcare and exposure to the virus. As healthcare professional educators, many of us stepped up to help the healthcare system. Many of our students took on positions as nursing assistants. Some of our faculty went to work in the hospital systems. When thinking back on the early days of the pandemic, I remember being laser focused on the news reports. If you recall, Governor Andrew Cuomo at the time would speak every morning from New York. And then in the afternoon, Governor J.B. Pritzker would speak on COVID in Illinois. I, for one, for at least a few weeks, made sure that I was tuned in every morning and every afternoon to find out about the number of cases and what was happening in this time that there was so much uncertainty. Nurses and other healthcare providers initially were hailed as heroes, but we know that there was severe nursing shortages. Eventually, nursing burnout became the headline, and there were shortages of everything from medications to toilet paper. Eventually, when the vaccine came out, many chose not to be vaccinated, many for legitimate reasons, but also some for believing the disinformation that was being propagated out there. High levels of COVID-19 health inequities were experienced by many in the United States, particularly amongst the Black, Latinx, and Indigenous communities. On top of all that, there was an increased public awareness and outrage of the racist incidents committed against Black men, women, and children without provocation, and many of them committed by police officers. There were increased hate crimes committed against people of color, and also against immigrants and Asian Americans and those of Asian descent. We have to remember that many of our students, faculty, and staff were among those that were directly affected by these things. How did we reach out? How did we make sure that people were doing okay? As nurse educators and healthcare educators in general, we switched our teaching modality to online learning. We thought it would be short-term. Many of us, after that mid-March meeting that we had on the 3rd floor, remarked to each other, see you in a couple of weeks, all of us expecting to be back before the end of the semester. Our clinical sites, if you recall, were so overwhelmed with COVID patients that they couldn't handle our students. So our students didn't have those clinical experiences where they mastered skills. We eventually turned to increased use of simulation, and the State Board of Nursing recognized, at least for now, that simulation could substitute for many of those personal clinical experiences. We were so fortunate here at UIC to have just opened the great state-of-the-art Christine Schwartz Experiential Lab where our students could learn. Many other schools were not so fortunate. As a profession, we also began to take a look introspectively and recognize the long-standing racism and white privilege that exists in our profession. At UIC Nursing, Dr. Phoenix Matthews held listening sessions where people could talk about their feelings. People talked about the racism that they experienced, as well as what we, people of privilege, had or had not done to propagate that culture. While all of this was happening, students, faculty, and staff were taking care of their children at home and educating their children at home. They were in Zoom class. They were also taking care of elderly parents. Oftentimes, they were the breadwinners, and many people in the service industries lost their jobs. Some of our students went home to their middle-class homes to study in the spare bedroom. Others struggled at the kitchen table while internet access was spotty and perhaps multiple people trying to get on a limited Wi-Fi. At this point in time, we can probably all say that we know someone who has died of COVID or COVID-related complications. There was no opportunity to mourn. Amidst all of this, there was great uncertainty with the pandemic, as well as the future of our country. And keep in mind that all of this was happening simultaneously. So lest we forget, amidst everything else that was going on, we had one of the most contentious elections of our times. Voting was taking place by mail, and in spite of that, voting lines were out the door. In-person voting access was limited, particularly in communities of color. The vote was questioned. Some people still today believe that the election was rigged. And then this happened, the insurrection. Who would have thought? There was an attempt to overthrow the election and the government. So when we think back, there are plenty of reasons, both within and with outside nursing education, for our students, for our faculty, for our staff, for ourselves, to feel the stressors of what was going on during this time, and also feel additional stress with their jobs, whether that be a job of a student, staff member, or faculty, and trying to adjust to that. So what happened at schools of nursing? Whoops, a little too fast with the finger. So as 2020 rolled into 2021, there was great hope on the COVID front. We had vaccines. This was the solution. This was the game changer. Healthcare workers mobilized, including us. Everyone pitched in on this coordinated effort. Schools of nursing, schools of medicine, schools of pharmacy, public health, faculty, students, staff. There was great partnership. And we had that at UIC. As a matter of fact, we were probably one of the exemplars of how things got done, of giving vaccinations, of cooperation, of making sure that our underserved communities were in fact getting the help that they need, at least to the best of our capabilities. So in the fall of 2020 and the spring of 2021, online education was still the norm, and we were getting good at it. We implemented practices that we had learned with COVID, and we successfully managed to bring students back for simulation experiences and some clinical experiences. There was an intentional effort to reduce the campus density to limit the spread of infection. Overall, however, stress continued to be high. Disinformation, not only about the election, but about COVID and vaccines, continued. The difference, however, at this time was that there was a sense of hope. We were emerging from this stressful year, but things were different. We actually started making plans for an in-person return to campus. Plans were made to retool our curriculum based on the new essentials, which had a big focus on health equity, which given the previous year was a really good thing. There was also recognition that public health and disaster preparedness needed to have a more prominent role in our curriculum. It was different though, teaching online versus teaching in person. Our teaching styles and also the learning accommodations that needed to be made by students. Some of our students adapted better than others. Some, particularly those with disabilities, found it easier to learn from home. They didn't have to travel in traffic, and they could be comfortable in their own home. Many, however, found online learning challenging. Some disengaged, turned off their cameras, and learning suffered. We are right now feeling the effects of some of not only the disengagement, but the accommodations that were made at every level, not only with nursing, but in pre-nursing courses, even back in high school courses. Students were experiencing anxiety and stress during this time, so accommodations were made. We lowered expectations. Tests were open book. We did things to make things easier, and this was appropriate given the time. People were suffering, people were stressed out. We as educators did not want to contribute to that in a bigger way. In an online survey of 2,326 undergraduate students, a much higher percentage of nursing students reported significant life stress in the previous week than their non-nursing counterparts. Over 57% of nursing students reported increased life stress and also depression. 57%, that's a large number. Students in general felt less confidence in their ability to be successful in the nursing program, to pass their NCLEX exam, and to provide safe, quality care. So I don't want to be all doom and gloom. We have been through some tough times, but we need to learn from them and come out stronger at the other end. So what are the lessons that we've learned over the past 2 years? And how do we make nursing education stronger and better? So before I launch into the next part of my presentation, I want to acknowledge the Macy Conference report recommendations that just came out in academic medicine last month. Some of what I'm going to talk about in the next few slides are recommendations that came out from the Macy Conference. Some of them are my own, but I do want to acknowledge this. There is an entire issue of academic medicine that was just published in March 2022 that is focused on lessons learned and recommendations as a result of the pandemic. And that's for both medical and nursing education. So people whose lives have been shaped by factors such as socioeconomic stress, racism, bias, food insecurity, in under-resourced neighborhoods are at a significant educational disadvantage, I should say. We need these learners to be future nurses. And therefore, as educators, we need to ensure that they have opportunities to advance. The Macy report stressed that social determinants of education also exist along with social determinants of health.
I can't believe how.
Equity does not equal equality. We cannot provide the same education, the same resources to everyone and expect the results to be the same. Some people carry around greater burdens, greater responsibilities, they've had different life experiences, and what they need from an educational perspective is different than what someone else might need. All along, we have relied too long on faculty of color to do this work for us. We are at an inflection point where all of us need to step up. Also, we need to recognize that public universities are vital. They're vital for making education accessible for all. At UIC Nursing, we use holistic admission processes to make sure that we take into account all aspects of an individual when deciding to admit them to nursing school. We have programs at UIC to recruit and retain both distinguished faculty and faculty from underrepresented groups. We know that critical thinking and diversity of thought is crucial for healthcare. We know that it's crucial for our society, and that's part of the reason that public universities are so critically important, particularly at this point in time. When we redesign our curriculum in the coming years, critical thinking will be emphasized even more than it is now. Stepping up also means affording our students the financial aid to be able to attain the education that they need. So we need to continue to work with our partners to make sure that scholarships are available for all of our students in need. And we also need to work with our partners to continue to combat racism, not only in education, but in healthcare systems and society in general. When we think about our students, this is not an overall fix. And what I mean by overall fix is sort of fixing what's gone on in the last couple of years. It's going to take a while. It's probably going to take several years. Keep in mind that our students from kindergarten through college spent 2 years learning online. Many of them only going to school maybe 2.5 hours a day, and the rest of the day they were expected to work on their own. Now we're talking about teenagers being expected to work on their own for 2 to 3 hours. Most often it didn't quite work out that way. So we've had 2 years where learning was limited, not only in colleges, but in high schools and grammar schools as well. Our students learn differently than we traditionally did. They use technology more. They tend to learn more in short snippets, getting short chunked pieces of information. As faculty, we need to adapt, and our teaching methods need to adapt to how they learn best. So our typical PowerPoint lecture just doesn't cut it anymore. I also noted previously that curriculum needs to focus on disaster readiness and responsiveness. We need to be ready for the next public health crisis. I don't know if we were to have another public health crisis on top of this one. I don't know if we're ready. We need to really work harder at this in order to be ready for the next crisis. Many of our nurses were faced with unprecedented death and dying. Back when I was a practicing registered nurse, I could probably count on 1 or 2 hands the number of people that died on my shift, the number of people that I had to prepare, do the death preparation. Some of our nurses were doing this daily, sometimes twice a day. So we need to prepare our nurses better for this so that they're able to handle this, and so that the load can be shared a little bit more than it was. We also need to learn from our mistakes during COVID. Was it really necessary to separate families? And was this done in an equitable way? Not only did we separate families where they couldn't be with their loved ones when they were dying, but then the onus fell on the nursing staff to be that person's support. Now, many nurses will tell you this was an honor that they were happy to do, but it also took a toll. It took a toll on their well-being. So with that in mind, self-care also needs to be part of our curriculum. It needs to be an important part of our curriculum. So as faculty, we need to refocus on how we teach so that our students actually learn the material that we're teaching. This is going to take extra effort. It's going to take extra effort on behalf of all of us. And we need to become familiar with the technology so we can capitalize on that technology so that we don't fumble through things when it's our turn to be the technological wizard. We need to be comfortable with it. As we address health equity, we also need to think about educational equity. Do students from under-resourced areas get the same chance at an education as students from higher resourced areas? Right? The reality is they do not. At UIC Nursing, we are doing things to promote educational equity. We've made a commitment to student success and student excellence, and we're trying to put resources in place so that all students succeed. We're looking at ways that we can contribute to the scientific knowledge base for those in underserved communities. There's no reason why there should be a 16-year gap from those that live on the Gold Coast to those that live in East Garfield Park. UIC as a university, but also us as a College of Nursing, are providing healthcare in those areas. We're providing healthcare where there are primary care and specialty care deserts, and we're there with our medical colleagues. We have faculty addressing maternal morbidity and mortality in Black mothers by looking at different models of care. For those suffering from long COVID, how can we better coordinate care to get people the treatment that they need? This is nurses' work. Our faculty are doing this work. As a public university, we're working hard to dispel disinformation about disease causality as well as treatment. We're preparing the future workforce. What can we do in a simulation experience, and what needs to remain in person? How do we translate those critical thinking skills that we teach students into a test or an experience so that we can ascertain what has been learned? In terms of education, what can we do to give back confidence to our students? Let's capitalize on these good things that we found with this remote capability and build on it. You know, in the past, inquiry into educational methods was not viewed often with as much prestige as research and patient outcomes, for example. But I think at this particular point in time, we do need to focus research on education. How do we educate students? What do we take from this COVID experience or the pandemic experience that we can use to our advantage to help better educate students? Work-life balance has become critically important. In our own faculty survey, this came out as being seen as one of the top factors that we as a college need to address. We have learned that we can work and learn remotely. What are the costs and the benefits of this new mode of working and learning? There certainly are definitive benefits to working and learning remotely. You can avoid traffic. There's increased accessibility for the disabled and those with chronic illnesses. Eventually, there could be less cost with building space. For our college, remote meetings have leveled the playing field for those in Chicago and those in the regional campuses. We also need to remember, however, that there are benefits to working and learning on campus. Last week, I gave some opening remarks at the Midwest Nursing Research Conference. I was reminiscing that how the two virtual MNRS conferences were done very successfully, how nice it was to be back in person. You know, that conversation over lunch that you might have with somebody at a conference or in the hallway here at the college can become the seed of a new collaboration. When you exchange ideas in an exhibit hall, for example, at a conference, or in the hallway here at the college, or perhaps sitting out on the bench as you eat lunch outside the college doors in the courtyard, oftentimes you talk about ideas and you become inspired, perhaps a new grant proposal. A chat, just a simple chat, might give rise to an educational innovation. There's a certain electricity in the personal interaction amongst colleagues. something that sort of wakes up within each of us the sensation of what drew us into nursing and education in the first place, and prompts all of us a communal pride in the work that we do and the impact we make in the profession that we love. Being in person also helps us, new faculty and students, develop as a professional identity as nurses and as educators. I truly feel bad for my colleagues who are new faculty trying to make research or other connections when so many of us are still working remotely. You can't just stop at someone's door to chat or share lunch in a conference room because people aren't present yet in the building. I think we as educators, as people, we need to figure this out. There is a balance. There's a balance to what we learned by being remote and a balance of what we gain from being in person. When it comes to work-life balance, we as faculty and staff need to lead by example. Working harder doesn't always mean working better. Breaks are important. Days off are important. So often, we tend to check the battery on our phone more than we check our own battery. I don't know about you, but I never let that phone charge go dead. It makes me nervous when I don't have enough battery that I'm not going to be able to have my phone accessible to me. We need to do that with our own battery. We can't let the battery go so low that there's nothing left. And our students need to do the same. So how do we do that? First, we can take advantage of our university and college resources. We can take part in the Take Care of Our Flames initiative. There are also many resources out there for our mental health. Use your vacation time. That's what it's there for. The work will be there when you come back. As faculty, we've talked about being intentional. If we could find 12 minutes twice a day, there's been research done that that's the minimum that it would take to recharge. It'll help our psyche. We've talked about standard time for meetings being reduced from an hour to 45 minutes. That gives you 10 to 15 minutes to recharge before the next meeting. Reducing multiple emails is another thing that we can do. Think about what you, think of what you need to do to recharge your battery and do it. Be mindful, be present in the moment. Some of you have noticed that I don't bring my laptops into meetings anymore, or I rarely do. And the reason for this is I found myself scrolling my email, looking for things on Google, doing things other than paying attention and being mindful for the meeting that I'm at. I think we all need to pay attention to that. If the meeting you're at, if you're paying more attention to your email, I think we need to ask ourselves, is the meeting really worthwhile taking place? So we need to be mindful of what we're doing with our time so that we have more of it. I find that music is powerful in determining the mood. Imagine if when we walked into a classroom that we had music playing. So just think about the mood you might be in if perhaps this was playing when you walked into the classroom. It might seem crazy what I'm about to say. Sunshine, she's here, you can take away. Hot air balloon, like a double space. With the air, like I don't care, baby, by the way. Because I'm happy, I'm alone. If you feel like a room without a room. Because I'm happy, I'm alone. If you feel like happiness is the truth. Because I'm happy, I'm alone. If you know what happy is to you. Because I'm happy, I'm alone. If you feel like that's what you want to do. So I'm not saying that when your students walk into your classroom, you always need to be playing happy or you need to be playing happy music. But I would guess that when they started saying sing along, be happy, that some of you probably smiled. I couldn't see your reactions because I'm looking at my screen. Some of you probably started sway to the music. And I hope that it maybe improved your mood just a little bit. There's a faculty member at The Ohio State University that begins each of her classes with line dancing. Students learn how to do the Macarena, they learn how to do the slide. It's 2 minutes at the beginning of each class that they dance. Now, again, I'm not saying that this has to be done or that this is maybe your way of doing things. But I think we need to think of things that can just sort of lighten the load, lighten the stress a little bit for each of us with our teaching with our students. We need to find ways to engage with students. Maybe we take commercial breaks like they do on television. You get a break from what's going on. Maybe show a vacation photo, play a game, do a mindfulness exercise, stretch, walk around. Well-being is really important for each and every one of us. I came across this poem and I'd like to just end this presentation. It's called Fight with the poem. It's called Fire. What makes a fire burn is space between the logs, a breathing space. Too much of a good thing, too many logs packed in too tight can douse the flames, almost assuredly as a pail of water would. So building fires requires attention in the spaces between as much as to the wood. When we are able to build open spaces in the same way, we have learned to pile on the logs. Then we can come to see how it is fuel, an absence of the fuel together that makes fire possible. We only need to lay a log lightly from time to time. A fire grows simply because the space is there, with openings in which the flame that knows just how it wants to burn can find its way. And with that, I thank you for your attention.
Thank you, Dr. Collins. Let's give a round of applause for this outstanding presentation. Use your reaction buttons, whatever you want to do. Thank you. And thanks for that song, because that definitely put a little bit of pep to my step here while I'm listening to your presentation. I'm sure that did the same for everyone else. So now I'm going to open it up for questions from the audience. Please submit those in the chat box, and then I will go ahead and read them to Dr. Collins. Let's start with, let's see, how are the enrollment numbers for UIC Nursing?
So our enrollment has stayed fairly steady. Over the course of the last year or two, we have had a slight dip in our DMP numbers, but not terrible, just a slight dip. This is happening throughout the country, and we think there might be some saturation in the numbers in terms of DMP. Other than that, our enrollment numbers are holding quite strong. We've also just hired a recruitment director to help us with that. So hopefully we can bring those back up to where they were. But again, they've not gone down by large numbers, just small numbers.
Okay. What do you think is the most important takeaway from our experience with the pandemic?
I think recognizing that it happened is probably one of the most important things.
Okay.
I don't think that we should continue to proceed as if it didn't happen. We need to recognize that it did, and people were affected by it, and make adjustments accordingly. Whether that's allowing for wellness breaks, allowing for some work, remote work. Just acknowledging that people have been through a rough time.
Right. What specifically is being done to build in work-life balance for faculty and students? Are these strategies being evaluated?
So we have our Taking Care of the Flames initiatives that have been going on over the last several weeks. And then we are looking at other things. Specifically, we are looking at limiting, it sounds small, but it's big, just limiting the email that goes out. I've asked one of our staff members to look into giving a presentation to faculty and staff about how do we use the controls that are available to us to limit email or to more effectively manage our email. I think here at the college, we're also trying to encourage people to use their vacation time, to take time off and to recognize that that time is needed.
Great. From an educational perspective, do you think that the changes in education spurred by the pandemic are temporary or permanent?
I think they're both. I think some are going to be temporary and some are going to be permanent. I do think there will be some permanent changes in regard to remote education. So for example, if somebody can't make it to class, perhaps there are alternatives where they can Zoom in, even though that's hard for the faculty. There are some things that I think are temporary, but things that we're going to have to do. So for example, our students, many of them, while they were learning online, whether their first 2 years of college or in high school, they've missed some content. And I do think that there's going to have to be a bit of a patch for a couple of years. We're going to have to support students probably more than we did in the past in terms of their scientific education, because there were accommodations that were made because of the pandemic. And again, this is nobody's fault. People did what they had to do at the time. It was how we coped. It was how we got through this awful period. But now we are having to make some adjustments. Some of our students might need some remediation, particularly in the sciences, either prior to or in conjunction with enrolling in our nursing programs. So I think those types of things are temporary. I think as we sort of get back to this new normal, I think all of that will kind of level out. But probably for the next couple of years, we are going to have to support our students a little bit more than we did in the past, particularly with the sciences in terms of their education.
Okay, what is being done to prepare students for the challenges in healthcare, challenges pertaining to discrimination?
So we here at UIC, we've held Phoenix Matthews, our Associate Dean for Equity and Inclusion, is just fabulous, along with our Diversity and Equity Committee. And we've done a number of different things. One of the things we've done is that we've reformulated our mission statement so that we say social justice, anti-racism, we say all those words, and we need to incorporate those into our programs. We've also held a number of listening and learning sessions, particularly in the summer of 2020, when a lot of the racial upheaval was going on. We held listening learning sessions where faculty and staff of color could talk about their experiences. But I found when I participated in them, they mostly listened. I think they had done enough. They were tired. But those of us, other faculty, could just sort of reflect on perhaps what we have or have not done to promote anti-racism in society in general. I'll just speak for myself. Phoenix had asked me, after I participated in a few of these over the summer, if I would reflect on my experiences. And Linda McCreary and myself, and I think it was the two of us, gave a little insert, just a presentation via Zoom on those experiences. And it was around the time of the election. And I remember an article came out in the New York Times, and it was focused on how Senator Warnock had to redefine himself during the election to make himself look more white. And it was just a shocking realization for me that this is what people had to do, people of color, to make themselves more acceptable to get elected. So I think those realizations are really important for all of us to focus on, both with our students, our faculty, our staff, but take a real close look at what's actually going on and be allies, allies to our fellow faculty members, students, and staff.
Right. It has been reported that applications in US to nursing and medical school are up as a result of the pandemic. Do you see this trend at UIC?
So some applications are up and some are not. We've not seen a huge uptick in applications here at UIC. We have seen there are more applications in our BSN program. But like I said, we're down just a little bit in our DMP programs. I am actually concerned about the future of nursing in terms of people wanting to go into the profession. I mean, the pandemic it has had a big effect, and people are just tired. And then you hear things in the news about legislators that want to limit pay for nurses, that they're getting paid too much and it's going to cause the end of the healthcare system. And then, of course, there's the case in Nashville where the nurse was convicted of homicide for a medication error. So I think we need to address some of these things. We need to kind of take these negative images of nursing and turn them around so we become that sort of desired profession that we want people to go into, because there is so much more good than bad. My experiences have been far more positive than negative. And I think we really need to turn some of this, some of the negativity that's occurring right now. We need to turn some of that around.
All right. I think that's it. If anyone has any final question, okay, someone just submitted a question. We cannot assume that all students and staff are tech savvy, allowing for efficiency and a way to support wellness for the nurse at the bedside. Is informatics a growing topic for students and faculty?
Absolutely, informatics is a growing topic. How do we take that information and use it to our advantage? There are many nurses that are going into informatics so that they can help us, and we need them to inform us on how we can sort of assimilate this information so that care can become more efficient, so that we focus on the things that we have to focus on and not, trying to find information or trying to figure out where things are located. These types of things we should be able to get through informatics. So yes, informatics is extremely important and an area that we teach about more often here at the college.
Great. All right. So that concludes our Q&A portion. Let's give Dr. Collins another round of applause. Yay. And thanks to everyone for joining us today. Just a few closing remarks before we conclude. Again, this was one in our series On Duty. If you go to go.uic.edu/news-events, you'll see all the upcoming events in this series, as well as any other additional events being planned for our alumni and our friends. In fact, we hope you can tune in this Thursday at 6 p.m. Central Time. Our UIC Alumni Association is honoring our very own Sheila D. Toulouse. Yay, and she's actually on this call. I don't know if she dropped off, she may have. She's being honored with the UIC Alumni Achievement Award. So if you go to that website, you could go ahead and register for that event that's taking place this Thursday. Also, please be sure to save the date for our All Alumni Reunion, which will be Saturday, October 8th at our Chicago campus. An invitation should be hitting your email or your mailboxes soon. One last thing for any graduating students on this webinar and any current alumni, please consider joining our Alumni Mentor Program. It's a great way to get connected and network with fellow alumni. If you're a brand new grad, it's a good way to just kind of, get some good information on how to get situated and adjusted into, your work life. So enrollment for that program will begin next month in May. You can email me salmas1, SALMAS1 at uic.edu with any questions. And you'll all receive an email early next week with all this information and my email address. So that's it for today.